Good day everyone! In this video, we're going to talk about peripheral arterial occlusive disease, upper extremity occlusive disease, and thromboangiitis obliterans. The first one is the peripheral arterial occlusive disease and the upper extremity occlusive disease. This is blockage or narrowing of an artery in the legs or rarely in the arms, usually due to atherosclerosis and resulting in decreased blood flow. These are the risk factors for the progression of this disease. First is smoking. Smoking is one of the risk factors because of the chemicals it has that affects the body, especially the nicotine, which can damage the blood vessel. Next is diabetes, obesity, and high cholesterol, which increases the risk of accumulated fats in the blood vessels. High blood pressure is also a risk factor. Another risk factor is the increasing age, especially after reaching 50 years of age. This is usually due to normal physiology of the body. As we get old, the blood vessels weaken. Other risk factors are family history of peripheral artery disease, heart disease or stroke, and high levels of homocysteine, which is a protein component that helps build and maintain tissue. What is the pathophysiology of this disease? Usually, the patient has underlying atherosclerotic disease. Accumulation of fats to arterial vessels is observed in this situation. This is illustrated in the image at the left side. With this accumulation, there is increase in vessel resistance. The vessel is narrowed, which leads to this situation. The narrowed vessel causes reduction of distal artery pressure and decrease in blood flow. Since the artery carries oxygenated blood, this means that there is lesser oxygen delivered to the extremities. Lesser oxygen received by the body leads to ischemia. The effects of this disease to the body are reflected with these signs and symptoms. The first symptom can be observed is the intermittent claudication. This is an aching pain in the legs when walking or exercising that goes away with rest. Discoloration of the foot, slower hair growth, shiny legs, leg numbness or weakness, and coldness of the extremities can also be observed due to lack of oxygen received by the extremities. If PAD progresses, pain may even occur when the patient is at rest or when lying down, which is called ischemic rest pain. Diagnostics and laboratory procedures. PAD can be diagnosed with the following procedures. We have ankle brachial index, physical examination, ultrasound, angiography, and blood tests. Ankle brachial index is a common test used to diagnose PAD. It compares the blood pressure in the ankle and in the arm. In physical exam, nurse can find signs and symptoms we have enumerated. Special ultrasound imaging techniques such as Doppler ultrasound can help in evaluating blood flow through blood vessels and identify blocked or narrowed arteries. In angiography, it uses dye injected into blood vessels, which allows viewing blood flow through arteries as it happens. This helps in finding narrowed area of a blood vessel. Blood tests can be used in measuring cholesterol and triglycerides and to check for diabetes. Medical and surgical management. Patients may take cholesterol-lowering medication called statin to reduce the risk of heart attack and stroke. Medications for lowering high blood pressure can also be prescribed. Aspirin therapy can be prescribed because PAD is related to reduce blood flow in the limbs, and it is important to improve that flow. Cilostazol can be prescribed because it increases blood flow to the limbs by keeping the blood thin and by widening blood vessels. It helps treat symptoms of claudication. Surgical management includes angioplasty, bypass surgery, and thrombolytic therapy. In angioplasty, a small hollow tube is threaded through a blood vessel to the affected artery. There, a small balloon on the tip of the catheter is inflated to reopen the artery and flatten the blockage into the arterial wall, while at the same time stretching the artery open to increase blood flow. Bypass surgery. In this procedure, the doctor may create a graft bypass using a vessel from another part of the body or a blood vessel made of synthetic fabric. This technique allows blood to flow around or bypass the blocked and narrow artery. Thrombolytic therapy. If there's blood clot blocking an artery, doctor may inject a clot dissolving drug into the artery at the point the clot breaks it up. There are also remedies that can be done at home. This includes cessation of smoking, exercises, healthy diet, and avoid certain cold medications that contain chemicals that can constrict the blood vessels and increase PAD symptoms. These are the nursing diagnoses that can be used. Chronic pain related to impaired ability of peripheral vessels to supply tissues with oxygen. Risk of impaired skin integrity related to compromised circulation. Ineffective peripheral tissue perfusion related to compromised circulation. Deficient knowledge regarding self-care activities. Nursing interventions include instruct ways to avoid traumas in the extremities. Caution to avoid scratching or vigorous rubbing. Encourage wearing protective shoes and padding for pressure areas. Provide good nutrition, adequate intake of vitamin A and C, protein, and zinc, and control of obesity. Lower extremities should be below the level of the heart, and encourage moderate amount of walking. The next disease is Thromboangiitis obliterans, also known as Burgess disease. Burgess disease is inflammatory disease of the small and medium-sized arteries and veins of the extremities. The blood vessels become inflamed, swell, and can be blocked with blood clots. This disease is greatly associated with smoking and tobacco consumption. Pathophysiology. We have mentioned that Burgess disease is associated with smoking. With smoking and tobacco consumption, it releases chemicals to the body. The main chemical that can cause great damage to the vessel is the nicotine. This chemical triggers immune response. The immune response of the body leads to inflammation of the vessel or vasculitis. With the platelets and protein factor, the inflamed vessel forms blood clots. The blood clot eventually causes blockage and narrowed vessels. This leads to decreased blood flow, which means decreased oxygen flow to the extremities. Signs and symptoms. These signs and symptoms are observed due to lack of oxygen received by the extremities. Color and temperature change in the fingers, cold sensitivity, lower extremity paresthesias, claudication, gangrene, Raynaud's phenomena. Treatment. Although no treatment can cure Burgess disease, the most effective way to stop the disease from getting worse is to quit using all tobacco products. Other treatment approaches exist for Burgess disease but are less effective than quitting smoking. Options include medications to dilate blood vessels. This improves blood flow and dissolves blood clots. Intermittent compression of arms and legs to increase blood flow to extremities. Spinal cord stimulation. Amputation if infection or gangrene occurs. Lifestyle and home remedies. These are the things that the patient can do on their own to help alleviate the symptoms. Exercise. This can ease some of the pain caused by this disease. Try at least 30 minutes of moderate aerobic activity. Skin care. This must be done by the patient regularly, protecting the fingers and toes. Checking for wounds and cuts is necessary because these may not be noticed by the patient. Avoid exposing to cold. Infection prevention. Low blood flow means the body can resist the infection easily. Small cuts and scrapes can easily turn into serious infection. The cut or wound should be washed with water and soap and apply antibiotic treatment. Gum care. Visit the dentist regularly to keep the gums and teeth in good health and avoid gum disease, which in its chronic form is linked to Burgess disease. Avoiding people smoke. It is important to avoid second-hand smoking too. These are the nursing diagnoses that we can use for this disease. Ineffective tissue perfusion related to blockage of vessel, chronic pain related to impaired circulation, impaired skin integrity related to decreased flow of oxygen to the extremities, anxiety related to actual or potential serious complications. Nursing interventions. Educate about importance of smoking cessation and assist in developing and implementing plan to stop using tobacco. Administer medications as indicated. Provide emotional support. Educate about importance of lifestyle changes including diet and hygiene. Encourage to lie flat on a bed with both legs elevated above the level of the heart for 2 to 3 minutes. Then sit at the edge of the bed with legs dependent for 3 minutes and then exercise the feet and toes by moving them up, down, inward, and outward. Lastly, return to first position and hold for 5 minutes.